Hi, everybody. Thanks for tuning in to this GHAPP podcast. My name is Lindsay Yoder. I am a PA in hepatology at the Indiana University School of Medicine in Indianapolis, Indiana. I've been practicing hepatology for almost 8 years, since 2017. And I am joined today by Melissa Franco. Melissa, you want to tell us a little bit more about yourself?
Hi, yes, Lindsay. Hi, everybody. My name is Melissa Franco. I'm a physician assistant in hepatology. I work at the University of Miami, and I'm very happy to be here. So thanks for inviting us. So Lindsay, I like to start asking you, but about unique challenges that we see that could affect patients' quality of life. How do you specifically tailor your approach to addressing these symptoms as a PA?
Yeah, so any of our patients with PBC, right? Those are my number 1 and 2 questions. Are you tired? Are you itchy? And then I think you can tell a lot by their first initial responses. And it seems like I have a spectrum of patients with PBC, some who are completely asymptomatic, and then there are others who are like a little itchy, a little tired, all the way to patients who like fatigue and pruritus are completely inhibiting their ability to do their job, for example. So I really try to focus in clinic interactions with patients who have PBC, really turning on my listening ears more than, for any other patient, and really listening to what they're saying in terms of like, are you tired? And then they'll tell me yes or no, but like in what fashion, right? Like, how is that limiting you? This often leads to a discussion of itching, because a lot of patients will say, my itching is worse at night, right? And so then that impedes sleeping. It leads to discussions about sleep hygiene. It leads to discussions about nutrition and physical activity, and trying to, kind of gather this sort of whole person, head to toe understanding of who they are, what's bothering them, limiting them, what is their daily life like, and what are some of the unique to that person ways that I think we can impact in a positive way, improving their quality of life as it relates to their energy level and their itching.
Yeah. Lindsay, something I started doing recently, which I didn't do before, is that, in the patients that present with pruritus, I'm trying to ask and grade the severity. So I ask them in a scale from 1 to 10, how severe is your itching? So I have a baseline to compare for the next visit. Sometimes they stop itching and then the itching comes back. So in that way, we can manage these symptoms. And I think very important for the pruritus, which is very bothersome for these patients, is making sure that they hydrate their skin all the time. They avoid wool. They avoid hot showers. They trim their nails, because sometimes with the itching, they get infections, right? They could get infections sometimes. So there are bats, these oatmeal bats, they could also help that with the itching. So these are natural, and some patients, menthol creams help, and some others, in some patients, it does not help. So whatever the patient finds that is helpful to them, they should do.
I think before we move on to the next question, I was going to say a good follow-up point to what you're saying too is, something else I think that can happen with providers outside of hepatology is if a patient has a liver disease, I will often see sometimes that other providers will tend to sort of like easily point the finger at their PBC for a gamut of, symptoms or fatigue and itching without considering like, is there something else contributing to, right? Like there doesn't have to be PBC. Number 1 and number 2 clinical signs and symptoms are fatigue and pruritus, but it's like, when was the last time your thyroid was checked, your vitamin D? Probably within at least the last year, because that's our guidelines within PBC. But different things, right? In patients with obesity, like have they ever been screened for sleep apnea? And different, things like that, where it's like, I always call it the low hanging fruit, right? So even though we know that these symptoms can come only from PBC and that be the only reason to have them. I think another important thing about sort of tailoring to each individual patient is making sure that not everyone else who's caring for them has not considered any competing alternate, etiology for those symptoms that may really greatly improve their quality of life also.
Yes, I totally agree with you.
And then next question for you. Sometimes some of these conversations get pretty difficult. Thinking about navigating fatigue, itching, possible, progression of PBC to cirrhosis and or need for liver transplant, or just overall the chronic nature of PBC can be challenging for some patients. And so how do you find that you kind of navigate these conversations while still empowering patients to make them feel that they can continue to actively participate in their care?
Yeah. So first of all, I like for them to feel that I'm supporting them, right? So we are healthcare providers, but we have to go for support. So um, I don't lie to them. I tell them that this is a liver disease. It needs to be treated. And this is a progressive disease. We can delay progression, but in some patients, as you know, they progress to cirrhosis. And cirrhosis is not a death sentence. It's just a different management of the disease. And once cirrhosis it's diagnosed, then of course, we have to do surveillance for HCC. There are for complications. We have to look for the ascites, esophageal varices, encephalopathy, and HCC. And a lot of these patients remain well compensated, and some others decompensate in the long term. And when this comes, that that's why it's very important that we do regular imaging and labs, because in this way we could refer to liver transplant when it's indicated. And when do we refer? When patients have a MELD score greater than 15. Now, if patients are not cirrhotic and they have some scar tissue, you could also risk stratify these patients with FibroScan, with FibroScan, with labs, looking at the albumin, the bilirubin levels, alkaline phosphatase levels. And you could also providers could also risk stratify patients using the PBC Globe score that use all these numbers to let you know if patients are at high risk for progression or not. And you can add second-line therapies. But I try to tell them and just letting them know that cirrhosis could come, but we want to delay progression. And it's possible in many patients. Many patients remain without cirrhosis, some others progress. But I try to be very transparent and clear to them so they understand the whole process.
Yeah, that's great.
So, Lindsay, how do you incorporate patient preferences and values when making treatment decisions about PBC, especially when balancing benefits of medications and potential side effects? How do you deal with that?
Okay, so continuing to think further about, patient preferences and treatment goals, right? So beyond first-line treatment, now we have several different options for second-line treatment. And I'm just pretty upfront in discussing these with patients, right? Like, what is the efficacy from the data? What are potential side effects? Sometimes it's, does insurance cover this? Do they not? How much is it out of pocket? Does someone, is cost is a concern to all of us, right? But some people have HSA and FSAs where they could handle a higher out-of-pocket cost. And for some people, that could be the limiting factor where that's not going to be a good option for them, no matter what. So I really don't shy away from those conversations with patients and just trying to be as transparent as I can. I also, again, have the, luxury of doing this for 8 years now. And so I don't think you can discount being able to share your own personal experience, although that's anecdotal, with your patients, but being able to really speak to saying, this is the subspecialty of medicine that I practice in, and this is what I have seen with my patients, our patients, and sharing that personalized insight with them based on their personal preferences. And I think this can expand to thinking about how you approach treating fatigue and pruritus as well, right? Because there are some younger individuals who are working full time, and particular antipruritic medications may have side effects that limit their ability to do their full time manual job, and different things. And same thing, with fatigue. There are some people who may say, yeah, I am more tired. I am somewhat limited. But it's not to the degree where they are, affecting their daily life and concerned about medication, for example, to help treat that, and different things we can do off label. Whereas other people are desperate and they really want to try anything that's possible. And you may have to fight a little bit harder for them, either yourself or through, primary care or one of the, other subspecialties of medicine we can reach out to help us address pruritus. Is it blue light therapy with dermatology? Is it as extreme as thinking about plasmapheresis because you've gone through every possible medication, right? And it's just not helping your patient who still can't stop itching through their 12-hour, nursing shift in the ICU. And so I really think knowing who your patient is, knowing what they want and what they need to do in their daily life. And again, of the priorities on the table, what matters most to them, it's going to lead you down, hopefully a partnership where you are taking into consideration your patient in front of you, right? Their preferences, and work together, to come up with treatment goals and strategies that hopefully, blend the best of the needs and the wants of everyone involved.
Yes, yes. I totally agree.
And so then, PBC management somewhat extends beyond medications. For you, do you ever have discussions about different lifestyle modifications with your PBC patients, trying to not be so prescriptive, but rather, suggest different ways that they can have that, patient empowerment of things that they can do beyond medicines to help their, quality of life?
Yeah, absolutely, Lindsay. Yeah, I think it's very important that we ask and we know their lifestyle, and we offer if they are leading or living an unhealthy lifestyle, if they're smoking, if they're drinking alcohol. So we should start by asking them if they drink alcohol, if they smoke, of course, to stop that. Diet is very, very important. So especially in cirrhotic patients, I make sure that they are consuming a right amount of protein per day. And the patients that don't have cirrhosis, they should have a healthy diet. Ideally, I recommend an Mediterranean diet or anti-inflammatory diet, because that will decrease the risk for other chronic diseases, and it will decrease the risk for cancers and so on. So diet is very important. And also I encourage exercise. I know that they are tired, they are fatigued, but believe me, as long as they move, yeah, they don't have to work out an hour, but if they walk maybe half a block and they start doing it every day, they will see improvement in their energy levels and the fatigue. I know it's hard, but patients that have done it have shown improvements in their energy levels. And I recommend, and then they could do cardio, they could do weight training for sure, at least 2 to 3 times a week. The ones that feel energetic enough to do it, and the ones that don't, maybe just walking a block every day is good for them. If they feel stressed, I also encourage mindfulness meditations to make them feel more comfortable and to connect with themselves. And it will help with anxiety and depression as well. How do you support your patients, Lindsay, in the lifestyle modifications?
Yeah, that's a good question. I mean, I agree with everything that you have said. I have a fair number of patients that really feel like those kind of like non-specific arthralgias and myalgias are something that can somewhat limit their physical activity. And it's not that they don't want to, right? They want to. I think sometimes that mental fatigue and some, muscle pains can really limit someone. So I like to also try to say, you don't need to set out to do like a separate exercise. If you have a dog, take your dog for a walk around the block, right? If you have grandkids or kids, go take them to the park and stand up and walk around and chase them a little bit, right? So some of that kind of like, don't make the idea of like exercise and cardiopulmonary, cardiometabolic health have to be a completely separate, different thing from your daily, activities. Just incorporate moving a little bit, more in something you're already planning on doing for the day anyway. And I think sometimes that gets that, it gets them that first step towards like being able to overcome what can feel like a mental load of like, my gosh, I don't feel good. The last thing I want to do is work out for 30 minutes. Okay, don't work out. Go just take your dog for a walk. Go hang out with your kid at the playground and don't sit on the bench the whole time. Go, interact with them a little bit. And I think somehow that kind of gets them over that initial hump to get them moving a little bit more, which I agree with you is incredibly important.
So thank you so much for listening, all. If you'd like to learn more and find out about more PBC education, please visit our GHAPP website or our GHAPP app. Thank you.